Hello everyone, I am Dr. Archana, fertility consultant at Ziva Fertility Manikonda branch. Today I am going to brief you a few things about fibroids. So what are fibroids? Fibroids are the benign tumors. That means that they are non-cancerous growth of the uterus. They are also called as leiomyomas, and these leiomyomas or fibroids, we can see them in different sizes, as well as the size may vary from a small grain to a size of a melon, and they may be even a single fibroid, or they can vary in numbers. They may be multiple fibroids in the uterus. So we generally see these fibroids in the reproductive age group of women, and depending upon the location where they are located, there are three types of fibroids. Like the uterus has got three layers, that is the inner layer, middle layer and the outer layer. When the fibroids are present in the inner layer, the most inner layer of the uterus, that is in the endometrial cavity, they are called as the submucous fibroids. When they are there in the middle layer, that is the muscular layer, they are called as the intramural fibroids. And when these fibroids are there in the outer layer or a little bit outside a layer of the uterus, they are called as the subserosal fibroids. So based on this location, these are named. Now what are the causing factors of the fibroids? So the exact etiology or the exact reason why these fibroids are growing, it's not really clearly understood, but definitely there are some risk factors which we have come to know, or which we can say that these are the causative factors for the fibroids. The first thing is that the hormonal imbalance. So that we have the hormones like estrogens and progesterones in our body. So if there is excessive production of these estrogens, can lead to the fibroid development. Like for example, when the patient gets pregnant, we see that the estrogens are really increased, and we see that the fibroids grow during the pregnancy, whereas during the menopause we see that these estrogens are decreased, and therefore mostly these fibroids tend to shrunk in size after the menopause. So the other causative factors are if there is an early menarche, which we call is, suppose if you get the periods very early, unusually at a very young age, even at the age of 7 or 8, or if you're having a late menopause, that is if your periods are not stopping even after the age of 52 or 55, generally these patients are at high risk of developing the fibroids. If the patients are having an familial history of fibroids, like if their mothers are having fibroids, or a sister is having, or a maternal aunt is having, definitely these patients are at high risk of developing the fibroids. And other causative factors are obesity. Obesity is also a very well-known cause of fibroids, especially those women who are into a heavy consumption of red meat, or for that matter high fat dairy products. Generally we have found that these women are at risk of developing the uterine fibroids.